Okay. In this session, that is the first session of the anatomy of human circulatory system, we are going to talk about a brief information about the introduction of this system, its function, and then I will explain the components of this system, which are the blood vessels, heart, and at the end of this class, we will talk about the mediastinum, which is the place of the heart. Okay? The circulatory system is also called the cardiovascular system, and it is the transport system of the body. Many materials are being transported by the cardiovascular system, like proteins, vitamins, antibodies, hormones, glucose, fatty acids, and the others. The system supplies the nutrients to the different tissues of the body and also remove the waste products from various tissues. You know, if the body organs and tissues want to work active in a proper way, they need some supply like oxygen, like vitamins and the others, and they have some waste products. The circulatory system will do this for all the organs. Also, the conveying media which do this activity in the circulatory system is a liquid in the form of blood. The blood is flowing in a closed tubular system which is called the vessels, the blood vessels. As we said, the most important function of the circulatory system is pumping the blood through blood vessels. The blood transports the nutrients and hormones and the other things, and also it has some role in gases exchange. As you know, the body organs need oxygen and also they are producing carbon dioxide. The blood vessels are transporting these gases, carries oxygen and carbon dioxide, and also they carry nutrients and wastes. The circulatory system has some role also in the immunity of the body. Okay? The immunity of the body is also related to the circulatory system or the cardiovascular system. I will explain how these functions being happen or occur. Now, the components of the cardiovascular system are the blood vessels, and the heart. These are the most important components of the circular system. I will explain each part one by one and talking about them in this session, okay? Let's talk about the blood. The blood is a kind of modified connective tissue. So, the blood is a kind of modified connective tissue. You know, all of the connective tissues have some cells and a kind of extracellular matrix. Cells and extracellular matrix. The cells are the blood cells which are present in the blood, and the extracellular matrix is the plasma, which is called the plasma, the extracellular matrix. Okay? The extracellular matrix and the plasma. Now, the question is, what are the cells in the blood? What are the cells in the blood? How many kinds of blood cells are present? Here we have three kinds of these cells. The first kind is the erythrocyte, or red blood cells. Here we have three kinds of the blood cells. Yes, it is okay to raise your hand. So, the first kind of the cells are the erythrocytes, which are the red blood cells. You can see the red blood cells in this picture. These are red blood cells. Yes, of course. Here. What is the function of the red blood cells? Their function is to exchange the gases, the oxygen and also hemoglobin. Okay? They are transporting these materials. The next kind of cells are the leukocytes. Leukocytes are the white blood cells. There are many kinds of leukocytes, yes, and they have the responsibility of the immunity system. The leukocytes have responsibility in the defense and also in the immunity. So, the immunity function of the circulatory system can be related to the leukocytes. The other kind of the cells are the thrombocytes, that here we have the platelets or the thrombocytes. And the function of these cells, yes, is in blood coagulation. If there is a wound in a part of a body or in vessels, these plate cells will come into each other and make a clot, so there will be the blood coagulation. These are the three kinds of the cells in the body, and as we said, we have talked about their function. The next component in the circulatory system are the blood vessels. Blood vessels are a closed network of tubes, which the blood is flowing inside them. The most important parts of the blood vessels are arteries, capillaries, and veins. So we have three important kinds of vessels, which are arteries, capillaries, and veins. They have some differences that we will talk about them in the following parts, okay? Here, in this picture, we can see the arteries. There are some branches that are connecting to the arteries. Look at here, the arterioles. They are smaller than big arteries. And then, after many branching, they will become the capillaries, the arterial capillaries. And then, at the end, they will connect to the venous capillaries here, with contacting these arterial capillaries, venous capillaries to each other. The venules will form, and at the end we have veins. At the end we have veins. Okay, now the blood vessels The first kind of, yes, the first kind of vessels that we want to talk about are the arteries. The arteries are thick walled tubes, and these are the distributing channels. They have many different parts and they have an elastic fibers. I will explain the blood that is flowing in each kind of the vessels. In the arterial capillaries, yes, we have the oxygenated blood, and in the venous capillaries, we have the deoxygenated blood, okay? I said we have two kinds of capillaries, arterial and venous. In arterials, we have oxygenated blood, and in veins or venous capillaries, we have deoxygenated blood. Yes, it's right. The arteries are the blood vessels that deliver the oxygen-rich blood from the heart to the tissues. Yes, let me explain about the capillaries more in next slide. No, it is not just the lung or pulmonary capillaries. Let me explain and ask your questions at the end, okay? So, we were talking about the arteries at first. We said that the arteries are the distributing channels, and they have thick walled tubes. They have elastic fibers and also circular smooth muscle. Circular smooth muscles. Look at here, in this picture, the pink or the red one is an artery. It has many parts. The inner part which is present here are the endothelial cells. After that, we have the elastic fibers and also smooth muscle cells. And at the end, we have the adventitia of the vessels. Okay? The capillaries are the microscopic vessels, and they have just one layer of the cells. They have just one layer of the cell, the endothelial cells. And the veins are the draining channels. The veins are the draining channels. As you said, the veins are carrying the deoxygenated blood to the heart. This is a picture of an artery. If you take a look on it, we can see the inner layer of the cells here, and we call that tunica intima. Tunica intima. These are the endothelium or endothelial cells that lies in the lumen of the vessels. Look at here. This is the lumen of a vessel, and these cells, the endothelial cells, are lying in the tunica intima. The next layer of vessels are tunica media. Here we have the elastic fibers. Look at here. This congregated layer is the elastic fiber. And then we have the smooth muscle cells. The last layer or the outermost layer of the arteries are tunica adventitia, and it has collagen fibers. Tunica adventitia, and it has collagen fibers. Okay? These three layers are present in the arteries. Yes, the inner part are the endothelial cells here. It's a layer of a cell and called endothelial cells. In the arteries, there is a connected junction and a firm junction between the endothelial cells. Because the pressure is high in the arteries, the tunica media is a thick layer in the arteries because the pressure of the heart is transmitting to the arteries, okay? These kind of blood vessels, I mean the arteries, are carrying the blood away from the heart. It doesn't have fibers. The tunica intima doesn't have any fibers, it has just cells, but there are some other layers like the basement of the cells, and these that are the details and we don't need to explain them. Okay? It is not just needed to know that the inner layer of the arteries of the tunica intima, which has the endothelial cells. But the elastic fibers are in tunica media here at the basement of the endothelial cells, and the collagen fibers which form to the arterioles are in tunica adventitia. Yes, the elastic fibers are on the basement of the endothelial cells. We said that these arteries are the thickest blood vessels. They carry blood high in oxygen, known as oxygenated blood, the oxygen-rich blood. The next kind of vessels were capillaries. The capillaries are near to 5 to 8 micron in diameters, and as you can see here, they are branching from the arterioles. At first, we have the arterial capillaries, which have many oxygens, rich oxygen blood, and then they become the venous capillaries. At the end, they are connecting to each other and make venules. How and where this process is happening? Look at here. The blood, as we said, the blood is transporting the materials and nutrients to the body. But the nutrients and proteins and other materials cannot come out of the arteries, because look at here, the arteries have thick diameter. So the materials in the blood cannot come out of these vessels, okay? But the capillaries, if you take a look at the capillaries, as I said, they have just one layer of the cell, which is called the endothelial cells. The junction of the endothelial cells in the capillaries is a kind of loose connection, and there are many gaps between these cells. So the nutrients, the proteins, the hormones, and other materials in the blood can pass through the capillaries and come into the tissues out of the vessels. We have the capillaries in all parts of the body. The most extended and the most complicated system in the body is the circulatory system. If you, for example, think about the respiratory system, you will see that it will start from the nose and will end in the lungs, in the chest, okay? But a system like circulatory system is present in all parts of the body, from toes, fingers to each small part of the body. So, at the end of each part, we can see the capillaries, and the function of the capillaries is to prepare the materials and nutrients to the tissues. Because of that, it has some small endothelial cells with loose connections and gaps between their junction, so the materials can pass through the capillaries and reach to the tissues aside from the capillaries. These are the smallest blood vessels. They connect the arteries and the veins. This is where the exchange of nutrients and gases occurs. So, we can say that the oxygenated blood is just in the, for example, pulmonary veins, okay? All of the venous capillaries in each part of the body have deoxygenated blood. When the blood has oxygen and it's full of the oxygen, it's flowing in the arterial capillaries. Think that, for example, here we have a spleen, okay? Or, for example, a kidney, or everywhere. The oxygen will pass through these capillaries and come to the tissue. And the waste materials and carbon dioxide will come into the vessels, to the venous capillaries, and bring back to the veins, to go to the heart. So, we have deoxygenated blood in venous capillaries, and we have oxygenated or rich oxygen blood in arterial capillaries. Okay, I think that voice problems, it's okay and routine. But I am recording the class. You can use it at the next time. So this was about the capillaries. And after that, we have veins. Veins are the blood vessels that carry blood back to the heart. From different parts of the body, they are carrying the blood back to the heart. They have some one-way valves which prevent the blood from flowing backward. They carry the blood that is high in carbon dioxide, known as deoxygenated blood, oxygen-poor blood. Listen, the blood is flowing in every direction. I mean, in the direction of the gravity, when it is flowing to the, for example, feet or leg, and also when it is flowing to the head, it's in the against the direction of the gravity, okay? In the arteries. And also, when the blood wants to come back to the heart, it has to flow in against the direction of the gravity in veins. So, there have to be some valves to prevent the blood to flow backward. These are a kind of valves. If these valves function in a normal way, it would be okay. But if these valves work inappropriately, and for example, like here, the blood flow backward into the, for example, legs, we will name it or call it the varicose veins. Okay? We will call that the varicose veins because these valves have problem and the blood will flow backward. So, the function of these one-way valves are many important. We have the one-way valve mostly in legs, and in the arms there is not needed. These valves are not needed. Yes, we call them varicose vein, and they have pain. If somebody have varicose vein, they feel pain in their legs. Yes, I will explain that again. Look at this picture. Yes, it can be solved by surgery. The blood is flowing from the heart to all parts of the body. When it flows to the head in arteries, pay attention, in arteries, yes, varicose vein is an abnormality. Please listen, I'm explaining the direction of the blood flow again, okay? The blood is pumping from the heart and it is flowing to all parts of the body. When the blood is going to head or going to legs, it has two directions, against and in direction of the gravity. After exchanging the gases, it has to come back to the heart. The blood has to come back or flow backward to the heart. And it will come back from the veins into the veins, okay? So, the veins of the leg have many one-way valves because they are flowing the blood against the gravity, the pressure of the gravity. These valves are preventing the blood to flow backward in the legs. If there happen a problem in the flaps of the valves, yes, these valves have many flaps. If a problem happens in the flaps of these valves, there will be an abnormality which is called the varicose veins. It has pain, the person feels pain in his legs, and the surgeon will remove these kind of veins from the legs. Okay? So, the veins have deoxygenated blood and they are carrying these kind of blood to the heart. Now we are going to talk about heart itself. In each part I will explain the vessels, the blood again, okay? Yes, these valves function automatically. They work automatically when a person is standing a lot. For example, some surgeons have to, for example, be standing up for 5, 6, 7 hours a day, okay? Or for example, somebody who works in a simple and a same position a day. This will happen for his legs. Because of that, we say that for everybody who work in this way, we say to put on some socks with the name of varicose socks. I don't know you hear about them or not. The varicose socks are so useful in this way, and also when you have to stop for a long time, it would be better to walk, okay? By walking, the muscles around the veins will work and these valves will function appropriately. But if you just stand up without walking, the valves will function abnormal and then this will happen. Mm, no, blood flow to leg is not against the gravity. It's in the direction of the gravity in the arteries. Pay attention. The blood flow to legs is in the direction of the gravity, but in arteries, in veins, the blood have to come back to the heart. So it is against the direction of the gravity. Okay? The direction is vice versa in arteries and veins. In arteries, it is in direction of gravity, but in veins, it is against the direction. Because of that, the veins have one-way valves. I'm reading your questions to answer. You mean two-way valves? No, I said one-way valves in veins because I wanted you to know that these valves just work in one way, against the gravity, direction of the gravity. Okay? Yes, no, it will not return. By surgery, the surgeon will remove this kind of veins, so the blood will flow back to the heart from the direction of other veins, the normal veins. You're welcome. Most of the time we are using our hands and moving our hands. So because of that, it is not necessary to have these kind of valves. I don't know what is the question about aorta. Brachiocephalic arteries, please explain little branches. Okay, I will explain the arteries. All of the arteries, of course. Repeat what? No. We don't have the varicose vein in arms. Pay attention. We don't have the varicose vein in arms. It's happened in legs. Because the movement of the hands is more than legs, and the blood is flowing most of the time. The muscles of the hands will help the veins to flow back the blood to the heart, so there is no need to valves. Just in limbs, in legs. The varicose veins can happen just in legs. Yes, the flaps are found in legs, not in arms. Yes, lower limb. Okay. Any other question about the valves? Okay, so I will explain again that the one-way valves are just present in the lower limb, not in hands, and their presentation is because of the direction of the blood in veins. And for the activities or jobs or some person who are standing for long times without any movement in their lower limb, they need to put on some varicose socks or move their legs, or for example walk and like this, to prevent the formation of the varicose. And after the varicose, because it has pain, they will do a surgery, and with the surgery these veins will removing from the body, from the legs, and the blood will flow back to the heart by the other veins. Okay, now let's talk about the heart. The heart is a four-chambered, hollow muscular organ which is approximately the size of your fist. If you close your hand and take a look on your fist, your heart is approximately in the size of your fist. The place or the location of the heart is on the superior surface of diaphragm. Look at here, this is the diaphragm, and the heart is placed on the superior surface of diaphragm, left of the midline. If we draw a midline here, 2/3 of the heart is on the left side of the body, and 1/3 of the heart is placed on the right side. So, we can say that the heart is placed on the left side of the body. 2/3 of the heart is placed on the left side, and 1/3 on the right side. Okay? And also it is placed on the anterior to the vertebrate column and posterior to the sternum. A sternum, posterior to the sternum, and anterior to the vertebral column. On the superior surface of diaphragm. Yes, the heart is the pumping organ which pumps the blood to different parts of the body, and it is pumping the blood to the arteries. Look at here. Let's talk a brief information, a brief details about the chambers of the heart. In next session, I will explain each why heart pump, then blood first flow in head, not lower limb. I can't understand your question. I will explain about the heart pumping. Listen, today I will explain a brief about the heart chambers, but in next sessions the completely parts of the chambers will be explained. Okay? The heart has 4 chambers, 2 atrium and 2 ventricle. 2 atrium and 2 ventricle. Here we have 2 sides of the heart, left side and the right side. The right side of the heart is full of deoxygenated blood. It receives and pumps the deoxygenated blood, and the left side of the heart is full of oxygenated blood. The atriums are the parts of the heart that are receiving the blood from everywhere, okay? These two parts, I mean the atriums, receiving the blood, and ventricles are pumping the blood. There are 8 vessels which are connected to the heart, and if you want to bring back the heart from the thorax, we have to cut these 8 vessels. One of these vessels is the superior vena cava, the other is the inferior vena cava. Superior and inferior vena cavas are bringing or carrying the deoxygenated blood from different parts of the body to the right atrium. Pay attention, please. The superior vena cava is carrying the deoxygenated blood from the head and the upper parts, and the inferior vena cava is carrying the deoxygenated blood from the trunk and the limbs and everywhere to the right atrium. There is a valve, tricuspid valve, between the right atrium and right ventricle. The blood will flow to the right ventricle. I will talk about the abnormalities of the heart in next sessions. Now we will talk about the formal and the normal form of the heart. Okay? The right ventricle will, the oxygenated blood will be carried to the right atrium from head and the upper parts by the vena cava, superior vena cava, and from the trunk and the other parts of limbs by inferior vena cava. Yes, the tricuspid valve is between the right atrium and right ventricle. The blood will pass through this valve and come into the right ventricle. By pumping, the heart will pumpage the blood from the right ventricle to the pulmonary arteries. Let me show you the pulmonary arteries. Look at here. This is the pulmonary trunk and these are pulmonary arteries. The blood will go to the lungs from these pulmonary arteries and exchange the gases in the lungs. Okay? After exchanging the gases, I mean giving the oxygen and getting back the carbon dioxide, the oxygenated blood will return back to the heart by these veins, I mean pulmonary veins. There are 4 pulmonary veins, 1, 2, 3, and 4. They are carrying the oxygenated blood to the left atrium. There is a valve which is called the mitral valve. Inferior vena cava is present in right side of the heart. This is inferior vena cava. Okay? The oxygenated blood will pour the blood into the left atrium and pass through the mitral valve. Yes, it has 2 flaps. And after that, the blood will come into the left ventricle. The heart will send or pump the blood to the aorta from left ventricle. Pulmonary veins, we have 4 pulmonary veins, 2 in right and 2 in left. They don't have any other names. We call them pulmonary veins just. Okay, the blood will be pumped to the aorta from the left ventricle. Here is the left ventricle and here is the aorta. If you take a look on the heart, you can see the diameter of the muscles in the left side of the heart is much more than the right side. So, the diameter of the muscles in the left side of the heart is much more than the right side, because the right side is just pumping the blood to the lungs. It is a short direction because the lungs are near or close to the heart, and there is no long way for the blood to go. But the blood which is going to aorta from the left ventricle have to go to all parts of the body like the head, limbs, and trunk. So it needs more pressure. The pressure in the pulmonary arteries which comes from the right ventricle is near 15 to 20 millimeter of mercury. 15 to 20 millimeter of mercury, but the pressure in the aorta is approximately 120 millimeter of mercury. Okay? Now, the heart is pumping about 70 milliliter of blood in each beat. In each heartbeat, the heart is pumping 70 milliliter of blood. So, it approximately 7 to 75 beats in a minute. So, it will be 5 liters in a minute and 7,200 liters in 24 hours. I said the myocardium, cc stand for milliliter. Milliliter. Yes. I said the diameter of the right side of the heart is less than the left side because there is no need to high pressure in the right side. The right side is pumping the blood into the pulmonary arteries, and the pressure in the pulmonary, yes, 1 cc is equal to 1 milliliter. The heart is pumping, the right side of the heart is pumping the blood into the pulmonary arteries, and it has just 15 to 20 millimeter of mercury pressure. But the left side has to pump the blood into the aorta, and the blood has to go to all parts of the body. Okay? Because of that, the diameter of myocardium in the left side is thicker than the right side. Yes, it can be increased. I will explain. Yes, the mechanism of oxygenated and deoxygenated blood is opposite in pulmonary veins and arteries. In pulmonary artery, we have deoxygenated blood. Pay attention, it was a good point that Mr. Fassi mentioned. In pulmonary arteries, we have deoxygenated blood. It will go to the lungs, exchange the gases, and after exchanging, in the pulmonary veins, we have oxygenated blood. Okay? Please, just think about and talk about the things that I mentioned. SA and AV nodes are not the topics in our session today. I will explain about the beats of the heart. The pulmonary arteries, yes, we have pulmonary arteries, not in this picture, but I showed you. I will show you again the pulmonary arteries. Okay, so this is the pumps of the heart. So the heart is an important organ in the body because it is so simple. It is just a muscular organ. It has 4 hollows or 4 chambers, 2 on the upper side and 2 on the downside or lower side, the atriums and the ventricles. The atriums are receiving the blood and the ventricles are pumping the blood. The pumpage of the heart will occur with each other in these ventricles, in both ventricles, and the right ventricle will pump the blood into the pulmonary arteries and the left ventricle is pumping the blood into the aorta. And they have different pressures. We have to say the function of the heart is so important because at first let's talk about the function of the heart. The heart is generating the blood pressure and also it is routing the blood. The heart separates the pulmonary and systemic circulation. As we said, the pulmonary circulation is on the right side of the heart, here, and the systemic circulation is in the left side of the heart, these parts. Okay? And also ensuring one-way blood flow. The heart valves ensure one-way flow. Look at here. We have tricuspid and mitral valves. They are also one-way valves from atrium to ventricle. So they are ensuring the one-way direction of the blood. And as you said, the heart is regulating the blood supply. How it can do that? If your body have many functions, for example, in athletes or somebody who is working a lot, the heart will change its contraction rate and heartbeat. Yes, the systemic circulation is on the left side. Systemic circulation is on the left side of the body. And if you have many functions, the heart will contract in higher rate and force match the blood delivery to change the metabolic needs. And when you are relaxing, when you are falling asleep, the heart rate will decrease because there is no need. Yes, during exercise, for example, like running or something like that. Okay. So this is the function of the heart, and as we said, although the heart is a simple organ, but it has many important functions. The other point about heart, let me finish this part and I will give you 5-minute break. The other point about the heart is that the heart is the first organ that starts its function in the embryos, and also it is the last organ that will finish its function. At the same time, blood is moved away or toward the heart? No. At the time of contraction, the blood will pump into the arteries. I mean at the time of systole. And at the time of diastole, the blood is coming into the heart. Okay? At the time of diastole, the blood is coming into the heart. And at the time of systole or contraction, the blood will enter to the arteries. The heart will start its function at day 20 of embryos, and by stopping its function, the person will be dead. Okay? If the brain stops its function, the person is not dead. You know, many persons in the ICUs, in the unit cares, their brain doesn't work, but their heart is working. But if the heart, yes, brain dead. But if the heart stops in function, it will be definitely the death. So the heart is so important. Yes, day 20 of the embryo. Yes, it's coma if we have brain death, but with the end of the heart function, it will be death. And, okay, I think I said a break, and then we will talk about the other parts. Both atrium are contracted and relax at, yes, they work with each other. Atrium and ventricles are working with each other at the same time. It's 9 o'clock, have a break to 5.9, and then we will start again. Okay. The next part that we are going to talk about is about the coronary circulation. What's the question? Yes, I said at the beginning of the class that the slides are enough for the exam. The slides and my explanation about each slide. If you are writing, it will be enough. But I will introduce you a reference in next sessions because I said I have to approve it. So for my exam, the slides and my explanations are enough. Okay? Don't be worried about that. Okay. About the circulatory, coronary circulation. The heart is the first organ which is using its pumpage. I will repeat it. The heart is the first organ which is using or supplying with its blood. As I said, the blood can't pass through the endothelial cells or the endometrium to reach to the muscles of the heart. So the heart needs nutrients for pumpage. Okay? How these nutrients will reach to the heart muscle? There are some arteries in the name of coronary arteries. They are two coronary arteries, left and right. Look at here, left coronary artery and right coronary arteries. They are branching from the aorta. At the beginning part of the aorta, there are two coronary arteries. By each pumpage of the heart, the blood will enter to the coronary arteries and will distribute in the heart, on the heart, look at here, and supply the materials to the heart muscle. In next sessions, I will explain more about the coronary circulation. Today, I just want you to know that the heart is the first organ which is using its circulation by the coronary arteries. Now about the thorax. Thorax is a cone part at the upper part of the trunk. So it is placed on the upper part of the trunk, lower than the neck and upper than the abdomen, between the neck and abdomen. The thorax or the thoracic cavity, I said it's a cone-like shape, but its basement is not a circle. It's like an oval because the side-to-side diameter is much more than the anterior to posterior diameter. So it's like an oval because the side-to-side diameter is much more than the anterior to posterior diameter. It has superior and inferior apertures. This is the superior aperture of the thorax, and this is the inferior aperture. The superior aperture is continued with the neck, and the organs like trachea, esophagus, and the others are passing through the superior aperture and come into the thorax. But the inferior aperture is being closed by a muscle called diaphragm. Here we have diaphragm. The diaphragm is separating the thoracic cavity from the abdomen. Okay? Now, the mediastinum is the position and the location of the heart in the thorax. If we separate the different parts of the thoracic cavity, we can say the most parts of the thoracic cavity is occupied by the lungs. Two big parts of the thoracic cavity on the right and left sides are being occupied by the lungs, right and left lung. And the space which is between these two parts is called mediastinum. So mediastinum is the space between two lungs inside the chest cavity. The chest cavity is separated by the lungs and the mediastinum. Look at here. If in the sternum we have a part which is called the sternal angle. If you touch your sternum, you can touch it. It is coming forward between the monobaryum and the body of the sternum. So between the monobaryum and the body of sternum, we have sternal angle, which is touchable in the body. Okay? If we draw a hypothetical line on this part, it will pass through the intervertebral disc of T4 and T5. Vertebra 4 and 5 vertebrae, thoracic vertebrae. Okay? We call that the sternal plane. Sternal plane. The space which is present upper than the sternal plane is called superior mediastinum. This part is called superior mediastinum. All the space which is inferior than the sternal plane is called inferior mediastinum. Okay? The inferior mediastinum is also divided into three parts: anterior, middle, and posterior. In the middle mediastinum, we have the heart. So, the place of the heart is in the middle mediastinum. The space which is anterior to the heart and posterior to the sternum is called anterior mediastinum, and the space which is posterior to the heart and anterior to the vertebrate column is called posterior mediastinum. So, generally, we have four mediastinums: superior and inferior. The inferior mediastinum is divided into anterior, middle, and posterior mediastinum. Each of these mediastinums contains many organs. For example, in the superior mediastinum, we have trachea, the arc of aorta, esophagus, and other organs. The inferior mediastinum, the anterior one, contains some lymph nodes, the thymus. The middle mediastinum contains the heart here and big vessels like inferior vena cava. And the posterior mediastinum also contains the descending aorta, esophagus, azygous vein, and other contents. Okay, I will explain the mediastinum again. I said we have an sternal angle between the sternal monovarium and body, which is touchable in the body. Okay, if we draw a hypothetical line from the sternal angle, it will pass through the vertebral disc between the thoracic vertebrates number 4 and 5. All the spaces that placed upper than this line is called superior mediastinum, and all the space that is inferior than this sternal plane is called inferior mediastinum. Inferior mediastinum is divided into three parts: anterior mediastinum, middle mediastinum, and posterior mediastinum. Anterior mediastinum is between the heart and sternum. Anterior mediastinum is between the heart and sternum. Middle mediastinum is the place of the heart, and posterior mediastinum is between the heart and vertebrate column. And as you say, the heart is placed in the superior surface of the diaphragm. Okay, this was the issues that I prepared for you for the first session. If you have any question about these things, you can ask me at the beginning of the next session. Then I will begin the next session's topic.